Welcome to County Fair on Waycross Community Media. I'm Government Programming Coordinator Dana Gagnon, and we have in our studio here Commissioner Denise Driehaus, because there's a lot to talk about countywide and things that are happening. So let's not stall anymore. Let's talk about,
Well, thanks for having me.
Oh, thank you so much for coming up. I know we're all kind of recovering from the busyness of holidays and trying to do holidays in a safe way.
Right.
And just so much that's been happening. And that actually leads me to the first thing I want to talk about. We are all sick of talking about COVID, but you know what? We're not done talking about COVID because it's still here, so we still need to talk about it to make sure we don't forget. So the county is doing a lot to track what's happening and help people stay safe and help with relief. So let's talk a little bit about that.
So County Health Commissioner Greg Kesterman has been a real rock star throughout COVID. He started right before COVID hit and has been doing the work ever since. So like a baptism by fire with this guy. But he and I have been great partners, along with the other county commissioners, trying to keep the community up to date on what's going on with COVID, how people can keep themselves and their families safe. I mean, basically, that's what we're trying to do. And so we've been preaching this message of masking and distancing and stay home when you're sick. But now people are most interested in, people hopefully have gotten their vaccines. Some haven't, and they're still willing to get them. So we've got a lot of vaccine opportunities throughout the county, and we've also now got testing opportunities because testing kind of ebbed and flowed. We had a lot of testing in the very beginning. County stepped into that space. We put like $16 million towards that from our federal dollars that we got through the CARES Act. And then it kind of waned, it went away. In the summertime, people were, and now it's back up again before the holidays, and now right after the holidays. So we're not really sure what to expect, but we're going to continue to do that. And Greg and I do these briefings. They're not quite every week, but they're close to it, just to keep the community informed on what's going on with COVID. But our numbers right now, as I'm sure you know, with Omicron, are moving up. The hospitals are full. People that get into the ICU are very, very sick, and 90% of those who are dying are unvaccinated.
Yeah, the statistics are, I'll mention that statistics because Hamilton County Public Health and your briefings and Greg's briefings, that covers what's locally known. We see information online, but it's not necessarily targeted to the area and the neighborhood that you live. So when we're listening to these briefings, we know this is what's happening in Hamilton County. Do we know what it looks like in hospital waiting rooms? You can look on national broadcasts, you can look online, but if we listen to your briefings, that's what's happening here in Hamilton County. Our hospital waiting rooms are full.
Yeah.
That's why we need to look at the numbers that are here in our county. And I've talked before about sources, checking your sources, where your information coming from. CDC, of course, Ohio Department of Health.
That's right.
But the Hamilton County Public Health Department has done so much tracking and so much information. And like you said, so much, there's testing available, there are vaccines available. Yeah. That's important because it's important that they're available to everyone, not just people who have more access to things.
Well, Greg's been great. And so if you go onto the Hamilton County Department of Health website, you're going to find scads of information about COVID and relief information as well. So let me just pitch the Test and Protect Cincy is the place where you can go to see where all the testing sites are, where all the vaccine sites are. And so there are many, many. And so you just go to that site and you can find that there. But, the thing about Greg and the Health Commissioner Kesterman, I should say, and his information is that he has these slides that he does, and you can see the progression from week to week or every other week to every other week, and you can see how we're doing. And so the trends are what matter. The numbers matter, but the trends are what really matter. And so our trend line right now is going up in a way that we haven't seen in about a year. I mean, it's been about since last February. And so it's heading up. It's not good news. But the thing that he also shows is who's getting vaccinated and how we're doing. And so those people that are above the age of 60, we're at about 80% vaccinated. I know, it's great. The 80-year-olds have really done what they needed to do, right? And so many of them are either homebound or in nursing homes or out and about, but they got vaccinated. And thank goodness they did, because they were the most vulnerable. But as you move down, you'll see a little bit less. But above the age of 60, we've done pretty well. As you get below that, you can see the drop off. And right now, there are more 50 to 59-year-olds in the hospital than there have been. That's because the folks that are over 60 are vaccinated and boosted. And so we are less likely to catch COVID than those that either have not been vaccinated at all or have not been boosted. And so you can see this playing out as Greg offers this information, on a weekly basis. And so it's really interesting to see that and to see how we're doing, and then give people the information that they need to say, if you're ready right now to go get vaccinated, we're gonna find out a way to make that happen. And Greg has set up the Board of Elections, which is a very central place with lots of parking. It's on a bus line. You can go to the BOE and get a vaccine. That's where I went to get my vaccine. It's quick, it's easy, the nurses are fantastic. And so we have tried to do everything we can to provide access to vaccine. And we also have mobile units that have moved around the county, especially during the summertime, in all different communities to make sure that people had access to the vaccine.
I have seen the 513 relief bus.
That's right.
It's come here to Forest Park. I know it's amazing because it goes to every neighborhood. It's not people who say, but I can't get to Norwood. I can't get to wherever else might be a clinic. That 513 van or bus is getting into neighborhoods where everybody already is, so that if someone wants one, it's there.
Yeah.
And these briefings that happen so frequently, I want to mention where people can follow them. At the beginning, I know we were all watching every statistic ever so closely. That was almost 2 years ago now. And I think we're not paying attention anymore. And I think as I was watching before Christmas, your last briefing before Christmas, I was struck by how much information is still changing and how much is still coming out and how much we need to see that, but also what's happening right here in our county, so that we can make decisions and we can know what we need to do. And holiday gatherings are wrapping up, but we're now jumping back into school and work and other kinds of things, board meetings and all those things we've so been looking forward to.
Right.
I mean, parents are probably looking forward to kids going back to school.
That's right.
But I think the fact that these briefings are still available, they're still happening, you're streaming them to Facebook.
Yeah, that's right.
So anybody who's following the Hamilton County Commissioner's Facebook page can see these in their feed. They don't have to go far.
Right.
We're broadcasting commissioner meetings, so anything that comes up in that too, but very easy to find.
Yeah, and we're doing them when we think there's relevant information. In the very beginning, we were doing daily briefings. So every day, Greg and I, with others, like Dr. Lofgren from UC Health was with us, Renee Mavey Harris with the Health Gap was with us, Health Collab, Kate Schroeder was on. So we had all different experts coming on in addition to myself and Greg, throughout that time, and we needed to do them every day. People were starving for information. Remember how new and the unknown was really concerning to people, and I get it. So then we started to taper back and do weekly. Right now, we're not doing quite every other week, but like before the holidays, I was getting a lot of questions about what should we do, how should we behave, and I called Greg and I said, Greg, I feel like we need to do one right before the holidays, before Christmas, and he said, well, let's do it, and so we did. And it was I think it was the most populated one of all. And I thought, okay, well, at least we got that right. And so we're doing one this Wednesday. It's kind of post-holiday. And then we're doing them, as I said, as new information comes out related to kids, related to boosters, related to closings or whatever's going on. We're just trying to provide people with relevant information. The other thing that we're doing is the county, thankfully, got a lot of money from the federal government a couple years ago through the CARES Act. And so we had a lot of relief money that we were pushing down into the community. We wanted people to know about that. So we had rent relief, we have mortgage relief, small business relief, we have nonprofit relief. And so we needed people to understand how to access relief if they were in trouble somehow, say on their mortgage, or they are a small business trying to keep their doors open. So So all of that information was also provided through the briefings. So if you go into 513 Relief, you will find everything that the county is offering through the CARES Act, which is last time's money, and now the American Rescue Plan, which is the new money, and how we're pushing that down into the community to try to fill gaps and make sure people have access to relief they need to stay in their homes or keep their businesses open.
That's the next thing I wanted to talk about, is that, we're talking about information with COVID, but also the county is not just sharing information, but offering sources of help.
Yeah.
513relief.org, that's the place. You've put it all in one place.
Yeah.
That's important because every time a government program comes out to offer relief, folks that are either a very small business, they don't have a staff to track this stuff, or individuals whose job situation has changed because everything has changed, don't always know where to find it.
Right.
So you have created, all three of you commissioners have created.
I do want to say it's all three of us. So
Yes.
Commissioner Dumas, Commissioner Reese, and myself. Right.
Yes, and I have really been impressed watching the three of you as a team just decide, what can we do? We need to do some active things. We need to not just talk about information, but actually see, all right, who's struggling? How do we fix this? And there's a
listen.
lot.
Just listen to people. I mean, people are calling in and saying, do you have this? Do you have money for this? And so we're trying to listen to where the need is and then respond to the need. A quick story. So when we talk about small business relief, which is really important to all three of us, originally the federal government had the PPP program where you could go and get relief, but so many businesses were left out because it was first come, first serve. And so if you're small, as you say, you don't have a grant writer, you don't have an attorney on staff, you're a small business, like less than 5 people, you didn't get access to that money, or if you did, it was just a tiny amount. And so we were getting calls from businesses saying we didn't participate in that. And so we said, all right, we're going to stand up a program at the county, use our dollars. If you had gotten PPP, and this is the first round, you were not eligible for the county dollars, because we were trying to help the folks that didn't get that federal money. And there were many, many of them, thousands of businesses. And so we've now run 3 rounds of small business relief, a lot of minority owned, a lot of women owned. Most of them are under 5 employees. These are kind of the mom and pops that just were really struggling. And so the lesson was that, while there was relief available, so many people didn't access it or couldn't access it. And so we had to step in and fill the gap. And so that's kind of been our space. Rent relief is the other one that people have thankfully been able to take advantage of through Community Action Agency and now Jobs and Family Services running this money out. It's still available, and we've got mortgage relief and utility relief too. So all these things are still available. You just need to access them through 513 Relief and get those dollars. But that's kind of how we viewed ourselves through this whole pandemic, was trying to stabilize, right? Stabilize families and stabilize kind of the business community as well.
I am really glad that you brought up that the listening and the filling the gaps. One of the things that I try to do in my role is help people connect to local governments, and people really see a lot of information of what is happening at the national level. What programs are they creating? We see a little bit of what's happening at the state level. What programs are they creating? How are we helping? The county is filling a really important gap, and we don't always see county government in our everyday life. So I think the fact that we're talking about that and letting people know their county government is filling some of those gaps. And if you're not even sure what kind of relief you need, just go there and call that number. And because you're listening to see what it is that's available and what might be needed next.
And we can pivot. I mean, and we have pivoted. With the small business, our 3rd round didn't look like the 1st round because we learned things as we went. The other thing is, if people can't or don't have access to a computer or can't get on a computer, they can call 211 and get talked through the relief that's available. United Way is helping us with that. And so the relief is provided through 211 as well. The other thing that we've done is keeping people in the loop has been really important, as information is constantly changing. So every month, this used to happen every week. I'm trying to remember the time frames, but now every month, I have a session with community leaders. It's all 48 or 49 jurisdictions, I should say, throughout the county. Electeds or administrators get on this call, and as they want, it's voluntary, of course, but we provide them with the same information that Greg does, but also a little bit deeper dive on what PPE is available. If a community, first responders need masks or gloves or sanitizer, we provide that. If a school district in somebody's community needs help, we provide that through EMA. Nick Crosley is the head of that. And so Greg does his presentation. Jeff Aludo's on there, county administrator, and says, okay, this is what we're thinking. What are you guys hearing? And it's a dialogue with these communities to say, what are you guys hearing on the ground in your communities? How do we benefit from that? And then how can we turn around and say, okay, this is our response, and this is the relief we're providing. So that has been really important too.
That's that layer of county government. We can't. It seems so inaccessible sometimes when we're thinking, gosh, we have needs, but Columbus is far, and forget DC, it's just too far. We have a county government, and you are actively connecting to all of our communities to find out what's needed, which actually brings me to the other really big thing to talk about right now. We're at the beginning of the year. It's time to talk about a new budget.
Yep. Yeah, I know. It's very exciting.
It is exciting.
I love a good budget.
The budget means enabling all of the things that the county does. There are things that the state mandates that the county does, and then there are projects that you do because the community has said these are things that are really important to us that enable all these things too. So let's talk about what the process is with that budget.
So we just rolled it out. We just passed it at the end of the year last year, so in December. Remember the county, let's do a little 101. So the county provides the justice system, so the courthouse and the court system, the jail, the justice center is a county responsibility. JFS is a county responsibility, so Jobs and Family Services. When you think about keeping kids safe in our community, that's a very, very high priority for us. Zoning, permitting. I mean, when you say people don't often interact with the county on a daily basis,
they do though, right?
Well, but we're the safety net,
Yeah.
and so if the safety net goes away, then you'd notice, right? And you would know it. And I know I don't mean to be critical.
No, you're right.
It's
you're
just
right.
this is how I explain county government to people, because you probably haven't interacted with us on a daily basis. But if we're not doing our jobs on a daily basis, you'll know it. And so we, a couple of years ago, slid a 1/4 cent tax from Union Terminal over to the general fund. No increase in taxes, but it was a rededication of that tax to general fund purposes. So it allowed us to do things like stabilize the county budget. It's always balanced, but there's a stability to this budget now where we can do some forward thinking. We are paying employees $15 an hour at least, which is good. We have a parental leave policy. We are trying to operate in a competitive set when it comes to wages. You hear business after business right now talking about how they can't get people to work, right? In a restaurant, a bus driver, truck drivers, so many industries are really struggling with getting employees. We're no different than that. And so we need to be competitive in our wages. And so we are trying really hard to level set that, to make sure that we are not only attracting employees, but keeping employees at the county. That provides stability, so that's very important. So this budget is that. It's a very stable budget. It's only the second year where we've had this 1/4 cent available to us. And so last year there was a little catching up to do. This year we're like, all right, everybody, we're managing this. Department heads are like, oh, hallelujah. We're able to move forward here. And we're also able to do some creative things that we have not been able to do in the past. So from my perspective, that's economic development in small communities. And so we've got this community revitalization grant. We rolled it out last year. It was about $1.5 million for grants to go into small communities. And so Gulf Manor and Cheviot and Norwood and Lockland all got the benefit of applying for and receiving grant dollars. But the request was $4.6 million. And we had 1.5. So we added in another about 500,000, included Springfield Township got in, it was Springdale, Evendale went in. So we were able to capture more projects, But you say to yourself, okay, can we do more than 1.5? Because we know there's a bigger need than that. And these are catalytic projects where in these small communities, they've got a project, they just need a boost, right? That kind of shot in the arm kind of thing to get it rolling. And so this year, we're going to do $3 million into that fund to see how we do. But also, it's a partnership with these local communities to say, we have not been able to do this before. We have not been in that space or really able to afford it. But we want to do something to help catalyze what they're doing and kind of match the dollars. And so I'm super excited about it. So that's one thing. And then there's a community impact fund too, which is about another $1 million for communities to really go in with that much money and really move that community forward. So those are the kinds of things we're doing. We're also doing things like bike trails have been funded here at $350,000. It's not a lot of money, but we know the quality of life issues that are related to walkability, rideability. For people want this stuff, and so the county needs to respond to what we know people want. And so just a couple of things that we're doing in the budget that are unique and pretty forward thinking, I think.
And that kind of revitalization, that's an investment in a community that pays off, because then it can continue to self-sustain and grow. And that's why there is economic development. That's why towns have someone keeping an eye on economic development. That's why you're keeping an eye on the county's economic development.
Right.
It's not something that happens. If folks are watching and thinking, yeah, but sometimes you're lucky and you get a business. That's never luck. If a community is able to grow with housing, or is able to grow with businesses that support their residents, and their economic base, that's because someone is doing a lot of work behind the scenes to make sure those things happen. So.
And we're trying to partner with no community. We don't know more than they do. Sam Keller does out in Cheviot, right? The mayor of Cheviot. Sam knows what he's doing. His council knows what they're doing. We are here to partner with you. Bring us a project that you think is worthy of a grant, and then we'll try to help you catalyze that project and get it going. That's kind of the idea. And so more communities than ever have started, I think, to see the county as a partner in that space, and that's great because we're really trying to work hard there. The other thing is, again, with the COVID dollars, the American Rescue Plan dollars, we're also listening to people with those dollars. So we have set aside a lot of money for transformative kind of projects in the county, brought stakeholders together related to housing, related to mental health, related to workforce and youth, and said, what do the experts know, and how can we absorb that and then respond to what we just learned? And so that's all going to start rolling out this year too. So we're in a unique position. It's like I call it a once in a career opportunity because of the federal dollars and the stability of the county budget, that we're able to kind of look a little differently, step back and say, other than the day-to-day, which is critically important, our number one priority, but also what else can we be doing here that moves this county forward? The other one is the justice reform work that we're doing, trying to better understand that there are people that are in the justice system that either have a mental health or addiction issue, and they would be better served not in the jail so much as in a treatment facility or in some. So we're retrofitting part of the jail for treatment beds, 90 treatment beds, which will alleviate some of the overcrowding, but also serve people in a way that is most appropriate and keep them out of the revolving door of the justice system. So that's fairly new, and it's something that I think we're also really proud of, just trying to meet people where they are, keep them out of the system to begin with if we can, but if they do enter the system, then try to figure out a smart way to keep them from re-entering and get them on the road to recovery.
We have talked a little bit about those kind of initiatives before, and I know that everything that we're talking about, each one of those, it really needs to be another in-depth conversation. So we need to plan a few more, I think. I will say that the entire budget is easily readable, which you can't say about a lot of budgets.
That's right.
And posted so that anyone can take a look at where do dollars come from, where do they go, what is mandated that you have to do, what are, all of that. It's just very carefully expressed so that it's understandable. And something that's nice to hear, property tax refund?
Yeah, the rollback.
Yes.
Yeah. So we did 100% of what has been promised many, many years ago by previous commissioners. Unfortunately, that's not going to be sustainable over the long term, but we were able to do it 1 year where people are struggling, and we recognize that. So 100% back this year. Next year, we're going to take another look, because what we can't do is starve the stadium fund, because we have obligations to both stadiums. And remember, they're county assets, so they belong to the taxpayers. So you can't not do waterproofing. You can't not do stuff for the maintenance of these buildings. And so we don't want to, get the funds so low that we're unable to meet our obligations. We also have debt service rolling out of that fund, and then we've just got obligations. So I was glad we could do it for 1 year. I expect that's not going to last very long, but we'll take a look at it every year.
And that is important to know. The obligations taken care of in a timely manner will prevent some really expensive things later.
Right.
Waterproofing is a great example.
That's right.
When waterproofing doesn't happen, really expensive things happen.
Well, that's right. And Riverfront went in deteriorated because of the lack of investment in that building or the stadium. And so we can't afford to do that. I mean, we've got 2 teams playing in the. How about those Bengals? How about the Bengals? I don't know if you saw the game yesterday. It was a good game.
I checked in to find out what the results were, and I'm not sure when folks will watch this, but today is a good day to watch the Bengals.
Oh my Lord! It was a nail biter until the very end, and so we clinched the title. It was very exciting. Anyway, so point being that we hoped that the Bengals stay with us for a while, and of course the Reds, who are fantastic. So we've got these great assets, we've got these great teams, and we want to do our best to keep them and keep these facilities up and running. And so that's what the stadium. And we have other funds. We've got a parking fund and other funds that fund various things. But so the general fund is one thing, and then the stadium fund's a different fund entirely. So anyways, it gets a little complicated, but we're doing our best to try to respond to the concerns of citizens, some of the challenges, especially during COVID, but also be fiscally responsible. We've got a healthy reserve in the general fund and in the stadium fund right now. And so we need to continue to do that too, because as we've just lived through, you never know what's going to happen. And sales tax, we were very concerned during COVID that the sales tax would dip to the point where we wouldn't be able to do what we do. Thankfully, that it took a little bit of a dip, but then it started to head back up. Okay. And so we didn't see that. The hotel motel tax, though, is another fund we have. Mm-hmm. Well, that went straight down. Mm-hmm. We had 0 rooms at one point, right? Nobody was staying in hotels. And so that has slowly started to recover. But that's the kind of thing you just don't anticipate. And so we've got a nice reserve in all of our funds right now. We have to do that to be responsible.
It's a really good example of, and we hope we never see another example like this, but why we can't just string a budget out and do whatever sounds fun. No. But it is appreciated. This is a good time for people to be able to, if the refund can only responsibly happen sometimes, this is a good time for that to happen.
Well, that's right. And I think that was the thinking. If we were ever going to do it, let's do it now, knowing that we'll have to take another look next year. And hopefully people have, climbed out a little bit by next year and the year beyond. So that was the thinking behind it.
I want to thank you for coming down. There's so many more programs and projects and initiatives. We clearly need to have some more discussions, but I just want to thank you for being so accessible. My whole goal here is to help residents connect to their local government, because that is where these decisions are being made that affects their neighborhood. And as you have mentioned, that's also where the relief is that they can access, where we might see things happening other places, but that's not accessible for us in a neighborhood.
Right.
So I appreciate, really all the commissioners have been so accessible.
Great.
And I really appreciate your time coming down here.
Thank you for having me. I'll come back anytime. And next time we'll talk about women and girls.
Yes, I can't wait. And we're gonna see if we can maybe have some of them come down and talk about their experiences too.
Yes.
Yeah, I want to start that whole conversation now too. But just thank you so much. And thank you for watching County Fair on Waycross Community Media. That means you want to stay in touch with what's happening in your local government.